Hi, everyone, and welcome to our webinar. My name is Ralph George. I'm the founder and creator of SmileFy. And today, or in this evening, I would love to show you the latest technologies, the latest workflow that we developed, and show you insights in Smile Design in a way it was done before. And also good evening from Brisbane, where I'm right now. And if you know me, what do I do in Brisbane? I was sailing the Pacific the whole year. And after 1 year of sailing the South Pacific, we reached Brisbane, as you can see here, on the 21st of November after the whole year, starting in Panama, Galapagos, French Polynesia, and then all the islands along the Pacific. And we reached Brisbane, we reached Australia, and we are enjoying the time in, for sure, most beautiful places in the world. Safa, so you will get the recording afterwards, so you don't need to record or do anything. You will get the recording. We have over 100 registrations. We record everything, and then after we finalize the webinar, we send you the recording. So, Smile Design AI, SmileFy AI. What is the idea behind all this technology that we develop? I think right now it's more important than ever to internalize that the technology that we develop is very powerful. The technology that we develop opens us the door to expertise and to experience from many decades of dentistry and aesthetics. Even if I started in 2016 integrating AI in the first version of SmileFy, afterwards developing the DSD application, back in the days, the AI that we have used was facial characteristics, facial proportions, calculating based on all these facial characteristics, the smile. But now AI reached a complete different level that on one side opens us the door to a lot of expertise, a lot of experience, and digitally offers us the opportunity to design the most beautiful smiles, but also the AI technology has to be used ethically and morally, because when you design a smile with one click and you show your patient a beautiful smile, this smile is created and calculated based on many parameters, facial characteristics, gingiva analysis. The smile is so perfect that you need to make sure that the treatment plan that follows is also feasible. And I'm going to show you some cases that work perfectly, and I'm going to show you also cases where the treatment plan is more complex. But the advantage of all this technology is that we have digitally the whole plan on the table, so we can decide and play digitally with all the puzzle pieces if this smile is feasible or not. So we can move step by step towards an ideal smile, a beautiful smile that we plan for our patient, and then see what's the issue, what's the problem, what is the path to reach to this point where we can deliver this beautiful smile that we have generated at the beginning. It's a new chapter in dentistry, and this chapter is gonna be more and more complex and more easy for us to use, but also the quality of thinking, the quality of analysis, the quality of the design, it's going to be so high that we have amazing opportunities to grow as a specialist, to grow as a dentist in this area of aesthetics, to, of course, to develop ourselves to the next level of quality, expertise, and so on. But now, enough talking. Let's show actually what I mean. Let me start with, I have some cases here that we can use. So this icon here, AI Smile Design, and let's select this option. And using this option, we can start, for example, with this case. It's very simple. On the right side, you have a lot of options. You have different categories: SmileFy AI, clinical documentation. SmileFy AVA is the video animation of the design. So you can transform, you can generate a picture, a smile design into a video and analyze the patient with movement. And then we have at the bottom, we have AI editing, picture improvement, and virtual patient. So picture improvement, you can remove the background if you have a background that it doesn't match or fit clinical requirements, like a white background, and you have flowers or you have offices in the background. You can remove the background. You can improve the picture quality. And the virtual patient, you can correct the position of the head virtually in the frame so that the patient looks perfectly frontal in the picture. But let's focus now on the options that we have here in the Smile Design. So we have Smile Design with natural colors, Smile Design with ortho and veneers, edentulous patient. We have the Hollywood smile. We have crown lengthening with a dominant smile. We have a new smile, ortho simulation, and bleaching. In her case, what about the ortho simulation? So I select ortho simulation and I click on AI Smile Design. Now we analyze the picture, and you will get a response. If you have questions so far, or whenever you want to ask something, please ask in the chat. I will answer all your questions. And so we will discuss every single aspect of this new technology, which it makes only sense when you have digital integration, a digital workflow to use the AI Smile designs into the 3D smile planning and design, and then to continue, of course, with the treatment plan. So that's what we worked so hard on, to have the Smile Designs AI, but to have all the Smile Designs integrated, of course, in the digital workflow so that we can digitally plan, comprehensive planning, multidisciplinary planning to reach the best smiles for our patients that can be done. Okay, so now you have the result here. As you can see, we have the teeth aligned, we have the same color, we have a plan, we have a proposal, we see now what can be done, and based on this picture, we can start our ortho planning, because now we have a facially driven ortho simulation. How can I relate what AI design has made for the patient 2D into a real treatment without failing the patient expectations? That's the next discussion, that's the next workflow that I'm going to present. We will take the AI simulation smile design and we will transform it into a 3D planning, analyzing every single piece in the way, on the way, every single step that needs to be done in order to achieve this smile. Good. So you have this ortho treatment simulation, right? And now the clinical documentation that we have released like 2 weeks ago gives you the option to create the same ortho treatment from different angulations. Because the smile, it's not the frontal picture. The smile is a profile picture, is a 45 degrees picture. So you need to see how everything is playing with the face, and you need to analyze, right, what can be done from different perspectives. So here is the clinical documentation. As you can see, now you have the same smile from 45 degrees and from the profile view, more or less. She's a little bit maybe 30 degrees or less, but nevertheless, you see now a lot of or more details in the simulation than before, right? So that's the initial picture here. We started with the initial picture, and then we have the clinical documentation created with AI. So we have different options. So let me show you another case. Maybe we do something with that's also a good example. We have a smile. Let's try ortho and veneers in this case. So you can see a little bit of, I'm not even sure if ortho is here a question. Maybe we start with the crown lengthening. Let's see what we get. So now our model or our models are trained with all the aesthetic rules and studies and characteristics that we have. Preston proportion, red proportion, golden proportion, facial characteristics, facial thirds, and so on. So we have a lot of facial analysis, and then we generate the smile. I had also, I'm looking for a patient, for a edentulous patient, but we can discuss afterwards. So here we go. Now, we have a reference now. We have a reference from an ideal smile that we want to transform into a 3D planning for our patient. We have an ideal reference, an ideal smile design based on all the facial analysis, all the rules, facial characteristics, Preston red, golden proportion. Depending on what the result of the facial analysis is, we apply the Preston proportion, the red proportion. Most of the smiles are red and Preston proportion. Then we generate the smile with a new smile curve. With as you can see, even the occlusal plane is corrected. So now we have a visual reference based on the facial analysis and the new smile design, what can be done in order to bring a new smile to the patient. I'm not going to create the clinical documentation now. Let me see here. So also very interesting, and it's even easier for this case, it's even easier for a edentulous patient because now we analyze the face. Frontal patient is missing. Frontal. Oh, it's just a second. Maybe this one. Yeah. So now it's even easier to generate a full arch implant bridge design for the patient. Why? Because we have the face, we don't have teeth, we don't have gums, we don't need to analyze the position of the gums, the gingival margins to create a smile. What we do is we create a smile that matches facial characteristics for the patient. Having this picture, you can now plan. Of course, the full arch implant bridge easier because the thing is you have the full arch implant bridge already automatically generated in SmileFy, and then you just need to import, calibrate the impressions, the scan, whatever it is, eventually the position of the implants, and then you have a reference, a visual reference, where to place this 3D smile in the face because you have the generated smile, and it's really, really facially driven, and it helps a lot, right? It helps a lot to see the patient with the new full arch implant bridge and to have a starting point where to go with the design. So let me download this case and I can show you. More. Okay. So now, here at the bottom, you have all the options that we have. So we started with the face, no teeth, right? And then we have the smile design. Then we have the clinical documentation to get more information about the position of teeth, the lip position, and so on. And then you can generate with SmileFy Eva, you can generate the video. It's an animated video of the patient. She doesn't want to be animated. Now here with the apple, with the green apple, and she bites and has new teeth. That's also powerful. You can use it for full arch implant bridge patients. You have a reference, and the facial characteristic, also this guy here, the facial characteristics are really powerful because you cannot fail the position of the teeth in the smile. If the patient has a low smile line, it is impossible to show the gingival margins or smiles unless we use aesthetic facial botox or filler. Again, what we can do is to work with the picture that you upload in the system, right? Now the very small details belong to the treatment plan, right? Belong to the treatment plan. Do we change the gingiva? Do we create a crown lengthening case? What perio, whatever it is. So what we do is the smile design. We show you what is the ideal smile design based on facial characteristics. And then the 3D smile design linked to this AI smile design in order to have a starting point and to know where to go. Now, you are right. If the patient, for example, doesn't want to go and to accept the treatment plan one by one, the way it is created in order to achieve this smile, then it's gonna be a different result. But for example, I'm gonna show you now in the 3D smile designs. even if the incisal edges are exactly the same like the AI smile design, right? And the patient doesn't want a gingivectomy, doesn't want crown lengthening, you can improve the aesthetics based on the incisal edges. And then you have a digital um, option to show the patient, number one, that's the smile that we can achieve if you accept the full treatment plan. That's the smile that we can achieve if you, for example, don't want the ortho treatment or don't want the gingivectomy or the crown lengthening. So now we talk more with digital planning, with pictures and what can be done instead of words. Because at the end, if the patient doesn't want gingivectomies or ortho treatments and so on, then the ideal smile, it's not going to be feasible. Considering the fact that we want minimal invasive preparations and so on. Is there any specification for the facial photo that will do the two design just for show the patient? Basically, the photos we need to do in order to show the patient? Yes. So the patient has to look exactly frontally in the camera, like this guy. So head position is perfectly frontally to the camera, and a big smile so that we have space in the mouth to design the smile. That's the only requirement. And with the iPhone, you can take the pictures with our AI, also AI module that we integrated years ago, where the iPhone is, so the SmileFy app on the iPhone is analyzing the position of the head of the patient, and it takes the picture only if the head is frontal. So you just move the camera in front of the patient, and the patient is looking straight into the camera. As soon as everything is perfectly aligned, SmileFy takes the picture, and then you have the most frontal picture possible that you can get. So here also we have this situation, and now we know where to put the smile in the face in order to achieve this result. Full art implant bridges with the design, I think, way easier because in such cases, teeth will be extracted, and then the whole arch is rebuilt. You know, you have a plan where to start and where is actually the smile in the face. Good. So that's the really easy one-click design. Let's select another version. What should we do? Okay, we take her. I also downloaded some pictures now from the internet because I need to test and I cannot show patients right all the time. But we have a frontal smile. We have the option to improve the smile. So let's try a crown lengthening and a dominant smile in this case. You can try different options. Bleaching, for example, is the teeth are gonna be white. Ortho simulation, as I showed you, it's the corrected position of the teeth. So the teeth remain the same form, the same shape, but they are aligned. And okay, I'll show you right now. Of course, the SmileFy Ava here, and then you have different options. Let's wait until the image is generated, and then we generate also a video. So as you can see, the smile is dominant. It brings some really power into her face and smile. If you are, for example, not happy with this dominant smile, you can select another one, right? Then we go to SmileFy Ava, and then we select, for example, young female patient, and we click, and now we generate a smile. As soon as the video is generated, we get a notification, and then we can watch the video. Good. Can you do a wax from an STL scan only if one tooth is missing so that you can play a single implant? Of course, yes, yes, that's the easy part. So that's really the easiest workflow. But more than that, what we can do to make sure that I'm going to show you right now, when the video is created, we start and discuss a little bit the 3D planning. So when you upload an intraoral scan calibrated with the picture, what we do is we segment automatically all the teeth. So if your smile design, for example, needs to be adjusted, or you have issues with the exhalangulation of some teeth, you have the option to automatically do an ortho correction, and then design the smile. But actually very interesting is that we can use this segmentation to replicate a tooth. So if you have a tooth missing, let's say you have the lateral missing, you go to the neck, to the other lateral, you select clone, flip, and then you get the same tooth on the other side. You can do it with centrals, you can do it with canines, and then you have exactly the same tooth, the lateral flipped on the other side, and then you can place your implant. So then the smile design that you have is exactly the same like the patient is, and it's really a matter of 5 minutes, not even 5 minutes, and you have a full 3D design. So let's see what we got with the video. She's what you see here, it's actually the newest version that we release now, because there is a new macOS and iOS version, so the operating system is new, so we had to update and make it possible for the newest operating system. And I see here the newest operating system has some interesting new issues that we need to solve. So the video doesn't play only if I move the slider manually with the mouse. So nevertheless, here is the option to select the video, to generate videos, and then to play the videos of the patient. Or maybe because we already record and share the screen, maybe that's the reason. I will check further. Good. So let's discuss now the 3D smile design, because we do have the AI smile design. That's fine, but how do we get the 3D smile design adjusted to the AI smile design, and of course then as a mock-up or a final treatment in the patient? So let's start with this. I already calibrated the picture with the intraoral scan. You just select the picture and the intraoral scan, 3 points on the picture, 3 points on the intraoral scan. Then the both files are calibrated. And when we calibrate the files, afterwards we send them to the cloud. We analyze the intraoral scan. We analyze the segments of so every single tooth, and then these two icons became active. They are inactive when the cloud is working, then they are active, and here you can start and design the 3D. But first of all, let's start designing an AI design using now this new picture. And then using this AI smile design as a reference to create a 3D smile design and to create a printable mockup. So here we go. That's our patient. We see it's a kind of an inverted smile. So the centrals, the laterals are a little bit too short. Based on the position of the premolars and canine, we should correct the smile curve of the patient. Let's see what the AI is proposing. Good. So that's our new smile. As you can see, small details in the angulation of the laterals, the centrals are more balanced, same size, the smile curve is corrected. We kept the smile dominance, right? So the laterals are shorter than the central inside the ledges. So she keeps the same facial energy, the same smile or smile harmony, but now with the corrected centrals, laterals, and canines. I think I like this smile. We save the AI smile design. We go to the next step. We save the smile design. We go back to the case management. The case management is where every single step, every single detail of the case of the planning is saved here. So we have patient files, we have the files calibration, we have the digital patient, and now we have the AI smile design. We can directly print the design, or we can export all the files, mockup files and everything what we have. Now let's start the SmileFy 3D design, having as a reference the AI design that we have generated. And here is really the interesting part, because now we have something that we like. We want to transform this smile design into a 3D model. We download now the data from the cloud, the smile data. You see at the top is the smile data. Means the intraoral scan, all the segments from the intraoral scan, and the data that we have analyzed in the cloud. Means we analyze the occlusal curve, we analyze the position of the teeth, and based on these two parameters, we build, or we propose actually to you, two different occlusal curves. One that follows patient's arch, and one occlusal curve which is ideal. In most cases, this ideal occlusal curve requires an ortho treatment to align the teeth properly. But you see, everything is quicker with AI, but at the end, you have the decision, you have to make the decision when it comes to the design and the treatment. Green, that's the symmetric occlusal curve. You can, of course, correct. That's the occlusal curve that follows patient's arch. It could be that they are very close to each other, or you can correct, and you see, and you can readjust the dots to readjust the occlusal curve. Here is important to know, if you create a motivational mockup, which is additive, so the new teeth are on top of the patient's teeth, well, it's a motivational mockup, right? Then you need to adjust the occlusal curve a little bit more additive. So it's not going to be touching the incisal edges like here, because that's an ideal design. So the new smile, it's going to follow exactly this curve, and the new generated smile, it's going to be exactly at the incisal edges that you define. If you want to create a motivational mockup, the teeth has to be on top. It's additive design, so you move a little bit the dots more buccally. I think the occlusal curve is fine, and now we generate the smile. You see the white teeth, segmented teeth of the patient. Now we know the position of them, the axial angulation, and everything else. And here is the smile, the 3D smile design that we automatically generate and propose. Now, let's see how far is the proposed smile from the AI design that we have as a reference. So I'm gonna hide the segments, the smile design, and we have our 3D smile design on top of the picture. And on top of that's the initial picture, that's the AI smile design, right? And here is our 3D smile design. So we are a little bit too low. We can increase now the actually the position of the incisal edges, right? Here I see the canines. We always have 4 views. So there is the cross-section view, so that you see the position of the new smile with the intraoral scan, and you see the angulation, and you see everything else. We have the option to change position rotation of every single design tool that we have. In step 2, we can select different templates, whatever we want. We have different form, different templates. Of course, we want now a very close form to the patient AI picture. And the smile frame that we have, it's a very also a new technology that we have integrated now, and it's important because, let me show you. In the first step, we have the smile proportions. You see the Preston smile proportion. The Preston smile proportion, which is exactly following. So our new AI design took the Preston proportion to generate the smile based on the facial characteristics. We have the red proportion as a reference, which is very close to the Preston proportion. And then we have the golden proportion, which doesn't match at all for this patient, you see? So when SmileFy AI generated the smile based on the facial characteristics, it decided I want the present proportion. Now we have the present proportion, we have the smile frame, the 3D smile frame, and we have the design. I don't know what have I done here that the position changed with our proportions, and so okay. Now what the new smile, the new 3D smile frame does is you can adjust everything in real time. You can adjust the height, you see. You can adjust the ratio, but we keep the present proportion, so we adjust the ratio. You can even easily play with the occlusal angulation and with the midline, with the dental midline, facial midline, to see what is the change of the smile, the harmony of the face. If you change the midline, the dental midline to the facial midline, or the other way around. So now you have a lot of options to play and to discuss with the patient. You can here select every single tooth one by one, and then change also the width of every single tooth. Also very important, because present proportion, red proportion, golden proportion, these are ideal situations. These are ideal calculations for a smile design. But if the patient doesn't have the space between the distal canine to the distal canine to place the smile into a present proportion, then we need to compromise to check if we can move the teeth with ortho in order to get the correct axial angulations for every single tooth, and then to design the smile. If we do have the space between the distal canine to put all the 6 teeth in between and to respect a present proportion, or we need to compromise somehow with the prep or with the size, the width of every single tooth. And then we have the intraoral scan. I moved the midline a little bit. So, good. Now we are very close in the incisal edges with our 3D smile, AI smile design. We see here the present proportion matches beautifully the distal canine to the distal canine. The correction of the premolars actually not needed in this case, because her premolars are actually good enough. What we can do is eventually correct a little bit the roundness of the incisal edges, and just for the mock-up. We can adjust a little bit the canine to cover like this, and to actually to have the design additive. And this is now the design between the AI simulation and the 3D translation, right? Very important also for us, it's the cross section. We want to see the cross section all the time. That's why we have 4 views. I see the cross section. I see, for example, what is the problem, right, with our design. And here I can adjust the axial angulation of my design to follow the patient angulation. And automatically I see the thickness of my design. That's very specific now, but I see the thickness of my design. I see the distance between the gingival margin and the incisal edge of my design, 11.74. I see the thickness of my design, and then I have some important information that I can share with my lab. But that's motivational design, so it's additive. No teeth preparation, no reduction now on the buccal surface, but it's the perfect translation between the AI Smile design and 3D. From here, we create the mockup. We have here the option to reduce automatically. You see the palatal area of the design, so that the design, it's at the end only on the buccal surface and not in the bite, so that the patient can speak and close the mouth without having material in the bite. And we can put some colors here, 3D light, to see. Let me turn off now all the references and everything. Here is our design. And in step number 6, I just click on a button and I create the mockup. So when I design 3D, I don't really care now about all the details, because my AI design was good enough, and that was my reference. So I just followed the reference, and where is my design? White. Okay. So here we go. That's my mockup. In step number 6, I can export the mockup or I can save the mockup. Of course, now I have the option to open the automated 3D design in the feature that I have with ortho simulation, so I can move teeth, I can correct actually the axial angulation of the teeth, adjust the smile design based on the corrected position of the teeth. I have a lot of options to analyze globally, actually, everything what I've done, patient situation. If, for example, if the patient says, I want ortho treatment, then you can simulate, or you can do actually the ortho treatment. You can simulate and display in the face the corrected position of the teeth, and then readjust the design on top. Here now a different case that I want to show you, because this case is, that's why so interesting. because it doesn't work. We do have the simulation, the AI design. We do have, and in my opinion, really um, a really good design. So the facial characteristics and everything are beautifully transformed into a smile. But I want to show you something that also is very important and a different aspect of the smile design and what we do. That's the patient. That's the smile simulation, the AI smile simulation, right? We go to the smile analysis and we display again the proportion. As you can see, the Preston proportion was selected automatically based on the facial characteristics of the patient. We do have a beautiful visual reference how to place our smile in the face of the patient. Let me go back. That's the smile design, the 3D smile design, which follows, you see exactly the incisal edges and the new smile. Oh, this canine is a little bit more tilted in like this, and this one also. So our smile design follows the AI smile design. The 3D smile design follows the AI design. We can still change the templates and select square incisal edges, whatever we want. But now that's the intraoral scan. So let me reduce the opacity to make it more visual and more clear. We have the ideal design, facial analysis, Preston proportions, AI smile design. We have the perfect 3D smile design adjusted to the AI smile design. And that's the intraoral scan of the patient. And now it is again, with all the technology that we use, and it's beautiful that we have this option, but now it's your decision. It's your expertise. It's your turn to talk to the patient, to explain what can be done. In this case, the arch of the patient is too small, means that the space between the distal of the canine and the distal of the canine, this space, it's not enough to recreate an aesthetic proportion like the Preston proportion, the red proportion. It's this space, it's not enough to recreate this, the ratio for every single tooth in order to get the perfect, ideal smile design. And now it's only a matter of communication, visual communication, and treatment planning. You see? What can be done? We have not enough space for 2 premolars. We have space for 1 premolar. If we want to redefine the Preston proportion and the facial characteristics, we need for sure gingivectomies and crown lengthening. We need for sure the ortho treatment. So I moved actually from when I designed, I removed actually the two premolars just to digitally, right, to make space and to visualize the ideal position of every single tooth when we redefine the Preston proportion, distal canine to distal canine, which is a huge treatment plan. So if we keep the this situation, right, then we need to redesign. Then we need to redesign the smile. And of course, redesigning the smile will change everything because we need to follow the width of patient's teeth. We have a little bit of space through prep or so. We have a little bit of space to redefine the width of the centrals, laterals, and canines. But nevertheless, what we can do is only the space between here, the distal of the canine and distal of the canine. And then when we redesign the smile, it's not going to be ideal. It's not going to be Preston proportion. It's going to be an improved aesthetic, improved incisal edges, improved smile, but far from ideal. So I wanted to show you this case because every single patient, every single case, it's going to be different, but it's beautiful because we can see it. We can analyze it. We can design. We can find out what's the limitation, what is the treatment plan, how do I achieve this smile? And every single step of this process, every single person involved, if it's a surgeon, if it's the lab, if it's a lab technician, everyone needs to be synchronized perfectly with the treatment plan, with the design, with the visual communication, in order to deliver for your patient really the best smile possible without compromises. It's always the question, dear patient, what do you accept? Ortho treatment, perio, palatal expansion, whatever it takes. With the new version that we have, we will release the airways and ortho version soon, in a couple of weeks, I think. We here. So we will go even deeper now into the multidisciplinary planning, and we will check the airways. We will automatically analyze with everything what we do the palatal index. You see, that's the corrected position of the teeth in order to be able to design the new smile considering axial angulation. That's the segmentation of the CBCT. And that's the original position of the teeth. That's the corrected position of the teeth. And then that's the design on top. So the thing is, it's not difficult because everything is now automated in the cloud, and it's the segmentation of the CBCT and everything. Then you define the occlusal curve for the ortho treatment. You define the position. It's very, very easy, and then it's automatically aligned. And then you can put the smile design on top. But that's something that is unique because you don't have a system in which ortho and smile design is linked the way it is now. And if you have more complex cases, it's beautiful to see what happens when one piece of the puzzle moves. What happens when you have all the ideal configuration and everything is digital, and then you can present to the patient what can be done, how can be done, and so on. How can be integrated CBCT with oral scan? Oh, that's easy. So you have the intraoral scan calibrated to the picture, and that's it. And then if you upload the CBCT is calibrated and segmented automatically by the AI in the cloud. So when you start a 3D case, it's gonna be automatically aligned, and then you have all the important information like axial angulations, bone margins, do the new position of my teeth, right? Where is it? Here. If I redefine the position of the teeth in order to design a smile, do the teeth, do the roots go out of the bone or no? So now you have every single important information in the planning workflow. In the planning workflow. Palatal index. If you move the teeth, do you have enough airflow in the mouth? Do you have enough? It's calculated automatically. It shows you based on the values and the volume from the palatal. It shows you it's risky, low risk, ideal. Then you know if you move the teeth, you also automatically analyze the airflow. And so we have a lot of very important details that we integrate in our thinking process of the design. So smile design becomes more clinical. It is more analytical. And I hope with all the feedback that you share with me, that we can create more and more guided workflows so that we protect actually everyone from making the wrong decision, because you don't have enough information. You have all the information that you need, and the app guides you through a process to get something for your patient, the best treatment possible. So it's a new way, it's a new mindset of thinking, it's a new mindset and workflow of smile design. So smile design, it's not just a 2D simulation or a keynote presentation that you showed to the patient, because I see here that's the biggest danger actually. Showing something, selling something, because now the social media is full of sell, 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 sell. You can automate a video, sell, sell, sell. Yes, but where is the clinical plan? You sell something that you cannot deliver. So we should link all the information, all the technology, all the expertise in workflows that we see, know, adjust, and then deliver. Can we do surgical guide for gingivectomy in SmileFy? Not yet. Not yet. So gingivectomies, sometimes what you can do is based on the position of the bone with the CBCT, you can create a design which is additive, like shells. You can measure the 3 millimeters from the bone, and then you can adjust your design, and you create like shells that you just place over the teeth of the patient, and then you just follow the gingivectomy. That's what many of our dentists do. So what I want to share with you is smile design will become more quick and easy, but also more clinical. Now that I'm in Australia, we have organized 3 hands-on courses. So it's not going to be presentations and discussions and presentation. It's going to be hands-on courses. We will design 2 days, all day long, different cases, different situations, your patients. We will design and learn every single workflow, every single step, so that you get to start into this new chapter of technology and smile design. So in Melbourne, it's gonna be the February 27th, 28th. Sydney, it's gonna be in March 6th, 7th, and Brisbane, it's gonna be in April 10 and 11. If you are interested in this technology, in this new analysis, in the new mindset of designing smiles and delivering and treatment plan, you can check our website with the course. I'm gonna share the website in the chat. So if you are interested and you want to spend 2 days with me designing smiles, discussing every single aspect of smile designs, aesthetics, technology, and practicing, you are invited. I sent you the link. You can see all the details of the course, what we do in the first day, what we do in the second day. Um, we will go deep into every single workflow, and then with a little bit of training from your side, in the 3D design, you will be able to print the designs and shells and even printed veneers in your office, and then you can share, of course, all the planning with your lab. And we have beautiful partners in Australia. You can you can share all your plannings with your lab, so that you get the best production of veneers and crowns that you can get. John Scolo, Russell Young in Melbourne. So people that uh, teach me so much in every single detail of what we do. And yeah, we now transform a lot of expertise into technology, and then hopefully from technology into beautiful results of with your patient. Yes, we do have courses in Miami. No, it's the same. It's the same course. It's just done by our trainers in Miami. I don't organize and do so many courses because sailing, I'm just now um, more or less restricted to the area that I'm sailing in. But we have our trainers, dentist trainers in Miami, in the US. Um, Jogo Alvarez, our trainer in Miami, dentist from New York. He's organizing all the courses in the US. Oh, for cases when planning injection modeling techniques, you can export the final design with alternating teeth. Yes, that's automatically done. So you do the design, you click composite veneer, composite restorations. The app is exporting two models with alternating teeth, full design, and one design with gaps, and then you can use the injection technique and restore the smile with composite. That's from this app perspective, is very easy. It's automated. You just have to get the best design possible, and then exporting and doing. That's automated, one click, and everything is done. Saudi Arabia, not yet. So I don't have any contacts in Saudi Arabia, but if you want to connect with us, we can organize. Of course, we can organize something. Thanks. So the summary of today's webinar. What I want to share with you is technology is getting quicker and better and more interesting than ever. But technology alone will not do the magic. So we need to use technology to be able to create the best digital smiles, the best treatment planning, and then to link the digital plan with the best expertise in dentistry, right? So your prep needs to be the prep files, the way you prep the teeth in order to make space for the veneers. That's the most important step in the delivery of new smiles. So the prep is very, very important. Your skills in prep are key for delivering beautiful smiles. Then a very important factor is your lab work, the technician, and the quality of your veneers and designs. How you communicate with your lab, with your technician, materials, the quality of the prep, how they produce the final veneers. From the digital to the real smile in the mouth of the patient. Everything needs to be at the best quality possible. That's why it is important to understand what technology brings us, but also to understand technology is not enough. It is always the hand of the dentist, the way it preps, the way it communicates with the patient, the way it creates the treatment plan. And we can bring all these expertise and experience together in workflows and technologies. But at the end, the the craft, the handcraft is the most important for delivering beautiful smiles. And then when you have beautiful cases, you don't need to sell with the app and with a digital picture. You sell with the picture of your result, of your patient. That's the best way to gain business and to increase the reach of your expertise. If you have cases with minimal prep and small adjustment, that's beautiful, because then you have a visual reference and you can really, like this case that I showed you with the girl, very small adjustments in the incisal ledges, the form of the central laterals and the canines, and it's a huge difference. It's a huge difference with the corrected teeth, and that's easy. That can be done in excuse me, in 10 minutes. And then you have the printer ready. You print the models, and then you can use the injection technique, and you can do it. A very important aspect that I also discussed with my good friend Russell Young, Omega Labs in Melbourne, is this mock-up or the provisionals over the prep. And if we have to right now to print the veneers, and the printed veneers are the final presentation and adjustment of the design in the face of the patient. If you use bisacryl, if you use resins, the resins fill spaces that shouldn't be filled, and then the provisional looks beautiful. But then if you go to the veneers, then these spaces are not filled anymore, so they look different, and the patient is the final veneers, they look different than my provisionals. Why? So here we have a lot of insights, a lot of things that we can also now solve with technology, to say we print veneers, and when we print veneers, that's exactly the same form, exactly the same like the milled one. So we can quality check, right, if our design and everything is done properly. Minimum prep with Emax 0.2 millimeters. So yeah, when it comes to the prep, there is a full workflow, right, created by Galip Gurel from Turkey. You have the ideal design, you prep through the ideal design, and you make space for the veneers. And how much you prep based on the expertise and uh, the studies of Galip Gurel and Marcus Blatz, you make space for the veneers, and you prep as minimal as needed for your material. If you have composite, if you have Emex, if you have whatever material you use. So it is important to understand, based on the material, you need a certain thickness, and you don't prep more and not less. So you make space for the veneers through the ideal design, and then you have the minimal prep and a beautiful starting point of placing the veneers with minimal prep. Very important, never prep before the design. Because if you prep before the design is going to be limited by the prep, the quality of the prep. If you create the ideal design first, and then you prep through the design, through the ideal design, then we get the perfect space for the design. That's number one. Number two, if you prep before the design, we will never be able digitally to check the axial angulation, if ortho needed, and so many options for a real treatment plan and quality treatment plan for your patient. So first, it is important to see the position of patient's teeth, see the design. Is there a benefit to align the teeth properly and then to adjust the design? And then ideal design, we see how much needs to be prepped, and then the smile design over the prep. The problem is sometimes the results from the lab not really the same as simulation. Yes, but that's a really big discussion, because the problem with the simulation is the simulation shows you an ideal picture based on facial characteristics and so many other points. Now, the result from the lab is also based on many factors. Are the teeth in the correct position? Do we need the correct axial angulation? Do we have space in the Preston red proportion for the new design? So there are a lot of moving pieces. Which workflow? Shervin, which workflow? The workflow with the so for example, so I moved the teeth. I moved them into an ideal position, which is of course not realistic, right? But here is the what we have here. We have the segmentation of the teeth, right? So I have the laterals, I have the canines. I'm gonna put them back where they were to see that we don't have enough space for this design. Now I need to realign a little bit here the teeth, but you see the segmentation is done automatically, and now we have here a situation. So if we cannot adjust and do the ideal smile design on this patient, we need to work with the space that we have. what we can do is we can align the teeth properly. We can align them based on the occlusal curve that we have. Inside the ledges like this. Here also. Now I just speed up a little bit here. What I do to show you. Okay, so we moved now our small correction. We move the teeth into a better position, axial angulation and all the position based on the smile frame and the occlusal curve that is defined by the smile frame. And now what we need to do is actually to redesign the smile based on the situation that we have. So based on the proportion that we have, which will be completely different. So you see, now I need to reduce the width of the centrals, reduce the laterals to make them work, to reduce the width of the canines. Where is the canine? Here. Let me reduce a little bit the opacity of the design so that we see. Midline. Okay. And that's actually the way we it's easier when we do it from the beginning. Now all the teeth are a little bit moved, but here the central, that's the space, that's the lateral, that's the canine, and here is the first premolar. Then I do the same here. So here and the canine and the premolar. It's easier when we start properly from the beginning, right? Because then we don't have so much to adjust. I select here tooth like this, and now that's the position of our new design. It's of course a compromise because we don't respect now any aesthetic rules, proportions, whatever it is, but it is adjusted. The design is adjusted over the intraoral scan, right? Over the intraoral scan, and now we have to check if we can get the CBCT from the patient, if we can see the gingival margins, seeing the gingival margins, if we decide that a gingivectomy will redefine, right, the gingival margins and so on. But here, you see, here we do have now the option to play with all the moving pieces and to find the best solution for the patient, of course, based on what the patient accepts. At the end of the day, if the patient doesn't accept gingivectomies, crown lengthening, ortho, and so on, then we are reduced to a certain workflow, correct the incisal edges, correct the form of the teeth, and then you can visualize a lot of stuff and say, yeah, if you don't accept this treatment plan, we go with this treatment plan, and this treatment plan has a certain limitation. That's the result, and you have the digital way to show it. Yes, of course, you can use the sculpt tools, and then you can mesh editor. Here you have different brushes, and then you can modify and sculpt everything. Good. So 1.5 hours. It's late in Sydney, and in Melbourne it's like 9:30. So you see, for example, if you take the form, right? The form, you have the sculpt tool, and then you can adjust here your design and the gingival margins, and everything is, all the options are here. Good. Thank you very much for your time. Thank you very much for your interest. I hope I could show you and introduce to you some interesting new technologies and the way we use them in order to create more beautiful smiles. I wish you good night. And the AI Smile Design is really easy. So if you install the app, you can start immediately, one click, and then from there, um, you can analyze. And of course, I would be very happy if I see you at our courses, hands-on courses, and we design 2 days all the time new beautiful smiles, and we discuss treatment plans and multidisciplinary plannings, and a lot of interesting aspects of smile design. Thank you for your time. Hope to see you soon. Bye.